Hi everyone, I'm Professor Hu from the University of Johannesburg. In this video, we are going to continue the study of basic theory of Chinese medicine. Firstly, we're going to introduce the holistic concepts. This is one of the key concepts that you need to understand, you need to use, and you need to remember. The holistic concept of Chinese medicine reflects the understanding of integrated of human body and the connectedness of human being in nature and social environments. So whenever you study each concept, the first thing you need to remember is the definition. You need to remember the definition according to the notes, and I will advise you to try to remember exactly the same words to memorize these clauses. Initially, try not to rephrase by yourself. The reason why to remember these words is because at the beginning of your learning, if you try to understand the concept and try to rephrase according to your understanding, you may have misunderstanding in the process, and it's difficult for you to pick up where they are, and then you will carry on the misunderstanding for your learning. So try to remember these a few clauses. The holistic concepts, you need to remember all these clauses. Firstly, it refers to the human body regarded as an integrated whole, composed of multiple level structures that are connected, instinctually connected, functionally coordinated, and mutually influenced, pathologically processed. So which means the holistic concept firstly is human body as a whole, different levels of structure. For example, your skin, your muscle, your bones, and all your internal organs, they are a whole. You can't separate them. You can't say the skin is not relevant to the internal organs. That's not true, or that's not the case in Chinese medicine, because we believe or we think that all structures, they are interconnected. For instance, if someone suffers from mouth ulcers, all the ulcers on the skin, the treatment we may focus on spleen. The reason is because from the theory, the muscles, the ulcers is related to the muscles and skin. The muscles related to the spleen, so we may treat the spleen for the ulcers. And sometimes you may say, is this true or not? How can I confirm this true? The direct evidence is that it works in clinic according to the theory, and then we got plenty or more than enough evidence that it works. One reason is because we have constantly practiced for thousands of years, and for these thousands of years, we test on human body, and you can see the evidence from human body. The second evidence is in the recent decades, the researchers, the scholars in the field of Chinese medicine try to investigate the function or the evidence of Chinese medicine from lab, from scientific point of view. If you search online, if you search on the database, you see that a lot of evidence-based Chinese medicine practice, or a lot of evidence from using scientific language to explain why it happens. If from lab, from gene point of view, so you can see we always see the human body as a whole. This is also why when you see in your consultation, when you see a patient, when you see, for example, when you see a headache, a patient suffers from headache, you don't only treat the head. You need to find the root cause of the disease. This is very similar to a plant. For example, a plant, a flower. If you see the leaves have problem, you don't only treat a specific leaf, but from the leaves, you need to try to conclude what happened to the roots of the plants, and then you're going to treat from the roots. That's the holistic concepts in a simpler words. You need to see the human body as a whole, the integrated whole. The second part of the holistic concept is the physiological function and pathological changes of human body are influenced by natural environment and social conditions. For the second characteristics, it refers to two perspectives. One is the physiological function. Second is the pathological function, which means either physiological, the difference between these two is it is in a disease condition or in a normal condition. Physiological functions means it's in a normal or considered as normal as a healthy situation. The pathological means refer to something that is not considered as unhealthy or disease stage. And both of these stages will be affected by natural environments and also these social conditions. So for the physiological approach, our pulse may be different according to the time of the days, according to the time of the month, according to the time of the seasons. When you feel your pulse, you will see even healthy people, the pulse will change according to spring, summer, autumn, or winter. On one specific person, you can see the pulse will change in the morning and noon and in the evening. For females, it's even more obvious. According to your cycles, you can see the pulse change along the cycles. That's also how we can predict your cycle from the pulse reading. So all these you're going to learn in the diagnostic techniques in the later in the second semester. So these are physiological function, and then pathological changes means even in the disease stage, your health or the human body also going to be affected. That's also why, for example, someone suffers from flu or common cold. If the same patient suffers from flu in summer and in winter, the treatment may be different because pathologically you're going to be influenced by natural environments, including where they live, the climate changes. The same apply to the same flu or the same season. So for example, let's use COVID-19 again as an example. Someone suffer from COVID-19 in Johannesburg and someone suffer COVID-19 in Durban. The treatment may be different. The development of disease may be different. The symptoms may be different just because of the geography changes, the location where they live, the body constitution of those patients. So these are still from the holistic concepts you can or you should have this type of thoughts. When you see a patient, you need to take these all into consideration. And then the social conditions refer to your social status. Okay, we're going to explain later in the next few slides. And the last one is the human life is sustained through continuous adaptation and transformation of nature and social environment. So this is basically the definition of how this concept. 4 perspective. 1, you need to mention is the integration of human body and natural and social environments. The second is human body itself as a whole, and the third one is physiological and pathological conditions going to be affected by social and natural changes. And the last one is the human life going to adapt the changes of nature and social environments. So these 4 perspectives you need to remember, and also you can see from especially those 2, especially all of them, they mention the relationship between human body and natural and social environments, natural environment and social environments. just from different perspective. So firstly is the integrators of human body and itself, including the holistic interrelationship of 5 zhang organs. The 5 zhang organs we mentioned briefly here, but you're going to study in the next few videos in very detail. And then the unity of human body and mind. Why you put the brackets here, the spirits, it's because of a translation. The direct translation from Chinese is spirit, but spirits sometimes is confusing here because sometimes spirits they also refer in religion. So that's why I use the word mind. We change, but when you read other material, they may translate into spirit. If you use the term spirits, you need to remember the spirits mostly related to the psychological process that's not religion related. This means the unity of human body and your emotion. For example, if you feel sad or you just fight with, had a quarrel or fight with your boyfriend or your girlfriend, and afterwards you don't have appetite, you don't want to eat. You see, this is the emotion changes affects your physical body. Because of the emotion change, you don't want to eat. From the emotion to the human body. So this is the unity of body and the spirit or the mind. Pathologically integrators. So this is similar to before. We said the pathological condition and physiological condition. Both of these going to be affected by nature. And comprehensive diagnosis and holistic therapeutics approaches. These we also will explain in detail after you study. So spirits in a broad sense encompass the outward manifestation of vital life, including mental states, consciousness, cognition, perception, facial complexion, impression, physical constitution, and posture and movements. In a more specific sense, spirits refer to heart mind. Heart mind we're going to study in the Zhangfu theory. Represents the mental, conscious, and cognitive process. This definition you also need to remember. Why you need to remember this or why we stay here is because you can see the definition of spirits, no matter from a broader sense or just more specific sense, neither of those includes religion perspective. So that's why I said in Chinese medicine we do not have a religion perspective. Just because this is an Asian medicine and sometimes the translation or the language may have some misunderstanding. The integration of human body, the physiologically and the physical integration, holistic integration of 5 zhang organs, and the holistic unity of human body and spirit. And then pathologically, these are actually quite similar in terms of the contents are similar. The difference is only they refer to the physiologically refer to when you're still healthy. The second is when you were sick and then you still have all these integration. And this image on the right side is the study in the Zhangfu theory. And I just put here to show you, to explain further, like briefly, how to link these. For example, in the heart system, the heart, the small intestine, the vessels, the tongue, and also the heart meridian, small intestine meridian, these are in one group in the heart system. So you can see, for example, from the tongue, the tip of the tongue, if you see the tip of the tongue is red, then you can see the heart fire. The patient may have painful urination. These are just from the integrated of human body, because from the tip of your tongue, we can predict, or we can say that this patient may have a high chance to have these problems. But how do you know? It's from the integrative of human body. When you see a patient with the tongue is pale or with teeth marks, then you can see this patient may have loose stools, diarrhea, more likely to have. Or for female, if you see the female, the tongue is pale, and then they may have more likely to have dysmenorrhea, painful menstruation, clots in the blood. So all these, how can we know these is from the integration of human body. This is also why after study the holistic concepts, you're going to gather the information from the observation. You can get the information from the voice of the patient. You can gather information from the observation of the tongue and facial complexion, and take the pulse as well, and inquiry. These techniques to gather all this information and now can help you to conclude one syndrome. That's from the integrated of human body. The integrity of human beings and the natural world. So basically, this is study the impacts of human health of the physiologically. For example, when you see these two images, one is a sunny day, one is cloudy with thunders, and all these, the nature environment is going to affect your emotion as well. When you see this, you feel psychologically you may feel happier or more relaxed. And this one, when it rains a lot, especially if it rains for a long time, for a few days continuously, your emotion also going to change. You can see these, that your emotion may be affected by all these environments. And if your body can adjust well, and if the changes of these climates won't make you be sick in the simpler term, then this the unity of human being with nature world physiologically. So your physiological condition going to be affected by these nature environments, and you still can adjust them well. But sometimes if your health is not that great, or for example, someone suffer from depression or anxiety, and then in those days when it rains a lot, continuous rains for 1 or 2 weeks, they feel more low, more down, just because of the changes of the nature, the environment. In the meantime, we also can use this type of characteristics to prevent diseases. For example, this is just in our daily life, someone suffer from arthritis. If they work in, for example, in the supermarket, especially in the seafood area, where they always have ice, always have air cons, very low temperature, and then those people may more likely to have painful joints or body ache just because of the temperature. So in this situation, you may advise patient to change the environment if they can, or just dress warmer. That's from the environment point of view for disease prevention. Okay, so that's why it's so important to understand this, the unity of human beings and the natural world. The last one is the interconnection between the human body and then the social environments. The human body and social environment still going to affect physiologically and pathologically. For example, you were a billionaire, and then all of a sudden, because of the changes, and then you got bankrupt. Just imagine that's your emotion, how your emotion going to change due to the changes of your financial situation, the change of all these. Or just imagine there's a couple, one family, the couple always fights with each other, and then how the kids going to be affected. So you see, these are social environments, the changes, and you can, if you think from this perspective, you should, or you will have a lot of experience. And sometimes we don't really see this just because you see the phenomenon, but you don't think from this perspective. If you think from this perspective, you can have more than enough evidence or example to explain these. So this is the holistic concept. Basically, we see the human body as a whole, including the structure of human body, the organs, the tissues as a whole, the human body and the spirits or the minds as a whole. So the physical body and the formless or the mind, the spirit as a whole, because your psychological process going to affect your human body. That's the first. The second is the human body and nature, and the third is human body and social environment. So you need to understand these, the holistic concepts. You'll be better if you can give some examples. And also this is the trick to study the theories, especially in the next few ones for the theory of yin and yang and 5 elements. And if you can use remember the examples, or if you can use some examples, or even if you can use these theories to explain the phenomena that you have seen around you, that's even better. Okay, so you need to remember the definition and then the key concepts in this. In the next slides, we're going to explain the syndrome differentiation and treatment variation. This is also very typical or very special in Chinese medicine or in acupuncture. This is slightly different from conventional medicine. For example, for conventional medicine, someone suffers from hypertension, they all prescribe with tablets to control the blood pressure. Although for precise medicine, they kind of to be more accurate on specific disease, on specific patients, they may give different type of tablets. But either way, all those tablets going to reduce or to control the blood pressure, especially for the primary hypertension. And then, but for acupuncture, we may need to investigate what's the reason for hypertension. And then for different patients, we may have different treatments because we treat in the root. Syndrome differentiation and treatment variation is the process of applying principle of Chinese medicine in practice by identifying specific syndromes associated with the disease, analyzing and corresponding therapeutic principles, methods, prescription, and material medica. So this is for material medica. For acupuncture, is exactly the same. You can use acupoints. So for herbal medicine, we use material medica, but for acupuncture, we use acupoints. So for example, these you can use the specific syndromes. These are actually the root cause. That's also why for our treatments, we don't focus on the symptoms itself. We more focus on the syndrome. For example, if you see the notes, you can see this tongue is slightly light red, but when you compare to the tongue on the right side, it's deep red. So these two colors of the tongue indicate two body constitutions. Your treatment may vary even with the same disease. For example, if this patient goes flu at the same time and all stay in Joburg, the treatment still may be different just because of the tongue, because their body constitutions are different. So that's the syndrome differentiation. For each patient, for each disease, we going to conclude to one syndrome at a specific time. And there are a few terminologies that you need to understand or clarify is the disease, symptoms or signs, and syndromes. What's the difference between these? For example, the first image, the patient have chest pain. This is symptom. Then you can see the changes of the fingers of arthritis this patient. These may be symptoms, may be signs. You can take pulse of the patient. You can observe the tongue, the thick coating. You can observe the palm, the hand, the redness around there. So what are these? Is you need to clarify. Are these diseases, symptoms or signs and symptoms? So what's the difference is, for example, on the right side is the coronary artery disease. A disease is the full development of disease. Let's see the next image. This is the full development of disease, coronary artery disease. For initial stage to the end stage, that's the entire process of the development. This is CAD. And then syndrome refers to specific stage of the disease. For example, this patient suffered from coronary heart disease, and then on day 1 or today, the patient comes to see you, and then the patient tells you, I got chest pain or chest tightness, palpitations, shortness of breath, and purple tongue, and one repulse. And this, you can, from this group of symptoms, you can conclude to one syndrome. And then if the patient comes to you next week sometime for follow-up, and on this specific day you still have a group of symptoms, and then you will conclude to another syndrome. Okay, so which means one disease may have multiple syndromes, depends on the symptoms and the signs of the patient of the current symptom. So let's go back to here then. For these, you will see the chest pain is a symptom, and the changes of the fingers, the joints, is also a symptom. It also can be a sign. The difference between symptoms and signs depends on if symptoms the patient report to you. If a sign is the practitioner pick up, for example, the tongue, the color of the tongue, the coating of the tongue, the pulse, these are the signs. As from as the practitioner, you collect the information, that's signs. The redness can be a symptom and signs, and the full development is a disease. So that's the difference among diseases, symptoms, signs, and syndromes. Syndrome differentiation, you need to determine the cause, the nature, the location, and the progression of the disease. You need to identify the etiology, why, the cause of the disease, the site of the disease, where it is, the nature of the disease, the cause, heat, deficient or excess, the progression, the outcome of the disease. So these will be included in syndrome differentiation. You're going to differentiate these 4 perspectives. Okay, this is syndrome differentiation. And then the treatment variation. The treatment variation is both the conceptual and practical process involved establishing treatment principles and methods, and selecting the appropriate treatment strategies for diseases based on the syndrome diagnosis derived from the syndrome differentiation. So as you can see here, the treatment variation, the treatment strategies or the treatment plans are based on the syndrome, the diagnosed syndrome, not the symptoms, not the disease. So for example, that's why I said if a patient comes to you for common cold or for flu, the same disease, you may have different treatments because of the syndrome may be different, because your treatment will be based on the syndrome. And when I say based on the syndrome, it's based on the stage of the disease, where they are. Depends on when they come to you. So for example, 2 chronic heart diseases or coronary artery diseases patient come to you, but they got different symptoms because this patient got this group of symptoms and the other patient got the other group of symptoms. Then your treatment may be different because you're treating the blastocysts for this patient, you may treat the other syndrome for the other patient because they have different syndrome. And the treatment principles must derive from the identified syndrome. So this is the golden thread in your practice. Your chief complaint in future, the chief complaint, which means why the patient come to you now. When you see a patient, hey doctor, I got headache, I got cough, I got runny nose for 2 days. These are the symptoms. The chief complaint must link to your first diagnosis, which means if I say that I got runny nose, I got cough and headache, then your diagnosis may be common cold, flu, and then your syndrome may be wind cold or wind heat, and then the treatment principle will dispel wind cold and wind heat. So that's why I said the treatment principle derived from the identified syndrome. For this situation, the treatment principle, the wind heat or wind cold, the treatment principle is to dispel wind cold or wind heat. So they must link the golden thread. And then a formula or the prescription acupoints is selected according to the treatment principle. So if you decide you want to dispel wind cold, and then you're going to choose the point that can dispel wind cold. If you confirm this is a wind heat, then you may choose another group of acupoints for wind heat. So this is the golden thread I mentioned. The symptoms and signs. From the symptoms and signs, you need to conclude to a syndrome, and then from the syndrome, you can conclude to a treatment principle, and then afterwards your treatment plans. Okay. Let's just use this as to see the one example. A patient Mary, and the other patient is Jacob. The first patient got runny nose, sneezing for 3 days, and sore throat, a red tongue with a thin yellow coating, and floating pulse. So if you don't understand the coating, the pulse, doesn't matter now because you're going to study in detail in this year. But just say for this case, for the diagnosis, we're going to diagnose this patient have common cold. Okay, from the sneezing, from runny nose, and then we diagnose as common cold. And because of the coating of the tongue, it's thin yellow. So yellow coating refers to heat. And floating pulse indicate that the disease is superficial from external exogenous pathogens. So we diagnose a wind heat invasion. And the treatment principle will be dispel wind heat. And then we use the formula in Chaosan. Or for acupoints, you're going to choose the acupoints for wind heat. Or you can prick to bleed to reduce the heat in the body. Let's see another patient. The other gentleman suffered from runny nose, sneezing for 3 days, the same. But this patient feels fatigue, a pale tongue with a thin white coating and tense pulse. The difference is the coating, one is a thin yellow coating, the other one is a thin white coating. The pulse, one is floating, the other one is tense. For this patient, we also diagnose common cold, but the syndrome difference, we diagnose a wind cold invasion. And then the treatment principle is dispel wind cold, and then the formula we choose Ma Huang Tang. And then for acupoints, you can use GB20, you can use 214, you can use moxibustion. You can see now, for the same disease of common cold, we choose different formula. For acupoints, we also choose different formula. So this is the treating the same disease with different formulas or different prescriptions. This is treatment variation. As you can see now, why we choose different formulas or different prescriptions is because these prescriptions derive from the treatment principle. And where does the treatment principle come from is the syndrome, not the disease. That's why we can treat the same disease with different prescription, treatment variation. And also syndrome differentiation, the same disease may have different symptoms, because of the manifestations are different. Okay, so this is one example of treating the same disease with different formula. Let's see another case. Still Mary, she got another problem. Menstrual bleeding for 3 weeks, feel fatigue and lower abdominal pain, pale tongue with a thin white coating. Now because of bleeding for 3 weeks, she feel tired and she feel a little bit of pain in the lower abdomen. The tongue is pale, the color of the tongue is pale, the coating is a thin white coating. So we diagnose irregular menstruation. The syndrome is spleen deficiency, and then the treatment principle is tonify spleen, because spleen deficiency means the weakness of spleen. We want to tonify the spleen, and then we choose the formula 补中益气汤. Or for example, in acupuncture, you can use room 4, room 6, large diameter 4, stomach 36 to tonify spleen. And then another patient, Jack Coates, he suffered from another disease now. On the other day, he suffered from stomach ache. He doesn't want to eat, poor appetite. He suffered from diarrhea, and the tongue is pale. The coating is also thin white. And then for this case, on this day, we diagnose Jack Coates as diarrhea or even stomach ache. Either way, you can diagnose. But the syndrome is spleen deficiency because of the pale tongue, because of the thin white coating, poor appetite, loose stool. So these can indicate the spleen deficiency of the syndrome. Your treatment principle will be tonify spleen, and then you still can use 补中益气汤 because 补中益气汤 can tonify spleen. For acupoints, you still can use room 4, room 6, stomach 36. You can use more special. As you can see now, for these 2 patients, you can use the same prescription, and you may both of these patients you can see good results. But when you go back to the disease, you will see one is irregular menstruation, the other one is diarrhea. So this is treating different diseases with the same formula. So these are also the treatment variation. Still, from this example, you can see the treatment, the prescription is based on the syndrome. The syndrome is based on the treatment principles. The treatment principle derives from the syndrome. The syndrome is from the symptoms. These are the golden thread. It's regarded as the disease name. That's why you can treat the different diseases with the same formula. And the last part is specific disease with specific prescription or mathematica for specific diseases, regarded as the syndrome. So this is the combination of syndrome differentiation and disease differentiation. We not only, as I mentioned before, we focus on the syndromes. We don't focus on the disease, even the case before with common flu. We focus on the syndrome rather than the disease itself. But sometimes we do focus on the disease. That's why you still need to consider the combination of syndrome differentiation and disease differentiation. For example, for malaria, we can use Qinghao or Swiss wormwood. That's where the artemisinin comes from. Dr. Tu Youyou won the Nobel Prize just because of she discovers artemisinin from this plant. Okay. Malaria, you can use this herbal medicine. The ulcerative colitis, you can use 代黄牡丹汤 is one formula. For furrowed shoulder, you can use stomach 38. So in future, you're going to learn these furrowed shoulder. Patient cannot lift their arm because of the inflammation in the joints. They can't lift the arm, they can't bend the arm, and then you can use stomach 38. Stomach 38 is on your legs. So this also, sometimes the patient will feel so surprised. Why I got shoulder problem, you're going to treat my legs? So this is because of a specific disease, we have effective acupoints can use for these. And for example, this stomach 38, sometimes you can see relief in a few minutes. So here it's the location of stomach 38. So in this video, we mostly introduce the holistic concepts, syndrome differentiation, and treatment variations. These are the two most important characteristics of Chinese medicine. We see human body as a whole. We see human body and natural and social environment as a whole. So you need to remember the details. You need to try to integrate all different perspectives when I see a patient, when I see a disease. So we don't really see a disease, but we rather see a patient, a human with disease. Okay, so you need to take all these into consideration. And the second characteristic of Chinese medicine or acupuncture is the syndrome differentiation and treatment variation. We focus on syndromes, we focus on the treatment principles. And in the meantime, you also need to kind of consider the combination of syndrome differentiation and disease differentiation. Okay, so in these two videos, we introduce these two concepts.